Hello, my name is Dr. Elissa Serapio. I'm an obstetrician gynecologist with UT Health RGV. My clinical practice is at the UT Health RGV multi-specialty clinic at Jackson Road, and I see patients for all their different reproductive health needs there. Today, we're going to be discussing breast cancer, breast screening, and other questions related to optimizing your health from a preventative perspective. So because of the pandemic, a lot of people have been understandably very concerned about seeing a clinician in the clinic. And luckily, there are many options for people. There's telemedicine as an option for people to understand what they might be due for in terms of preventative care. So that's a good place that I encourage a lot of people to start with, is schedule a visit with a clinician to talk about if an in-person visit is necessary. And sometimes a person can get an order for their mammogram without even having to go into the clinic. Of course, you have to be in person for obtaining your mammogram, but you can cut out the first step of going into the clinic to get the order form for the mammogram. So the primary tool that we use to screen for breast cancer is mammography. And we know that more and more women are surviving breast cancer because cancer is detected earlier and earlier. And when cancer is detected early through screening, that optimizes people's chances of survival and a good outcome. So everyone is different in terms of their individual risk factors for certain cancers and other issues. So depending on a person's individual situation related to their personal history, their family history, their age, any genetic conditions that might be in the family, screening intervals are individualized. And so I always encourage patients to talk about their individual situation so we can make a plan about how frequently it makes sense for them to have mammography, have a clinical breast exam, do their pap smears for cervical cancer screening, and all of the other important preventative health care that is necessary to ensure that they are getting done. So we know that most breast cancers are actually found by a woman herself. So it is really important for a woman to understand what her breasts normally look and feel like. And this kind of concept of just a general awareness of what's normal for an individual woman is what's called breast self-awareness. That's what the current recommendation is for women, is to have an awareness of what's normal for their breasts so that they can tell if there's a change. And if there is a change, they can report that to a healthcare professional. So the age at which women need to start having their mammograms done is really dependent on the individual woman and her family history. If she has a personal history of, for example, chest radiation from prior cancer, if she's ever had a breast biopsy before, things like that, and of course her age. And so bringing her whole history with her to her conversation with her healthcare provider, there can be a discussion about should screening start at age 40, 45, or 50. And there are different guidelines that say that really starting at any of those ages is appropriate depending on that individual person's unique circumstances. Generally, all the guidelines do say that by age 50, a woman should start having regular mammograms. So for people who want more information about what they need for optimal breast health, I really encourage you to make an appointment with your healthcare provider. It can again be via telemedicine to start off with, to ask questions, find out what preventative health needs you're due for. People can make appointments to see us either in the clinic or on telemedicine at the uthealthrgv.org website. The other websites that people can check out to learn more about breast health are the CDC website. The CDC has lots of good information about all the different diseases that we need to be aware of. So CDC has information about all the different cancers, including breast cancer. And then there are a lot of really wonderful nonprofit organizations that try to raise awareness of breast cancer issues and and care overall. One very well-known organization is the American Cancer Society, which is at cancer.org, and they have a lot of good resources about breast cancer as well.